Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, and a huge welcome to Muaaz Saith, who is a qualified physiotherapist currently in private practice at the Crown Med Day Hospital in Johannesburg. He qualified from Wits University and now has over 6 years of experience across the public and private health sector in South Africa. He goes on to say that he's very passionate in helping his patients to improve and restore movement, function, and quality of life with treatments such as cupping therapy, dry needling, and a whole host more, which we will unpack during the course of the interview. Assalamu alaikum to you, Muaaz. Welcome to the program. Lovely to have you here.
Wa alaikum assalam. Thanks for having me on the show. Much appreciated.
Alhamdulillah. So, look, the area that I live in, I find from time to time ladies putting out adverts, inviting the women of the community to come for hijama sessions. And they also talk about specific days of the month that is supposed to be ideal or recommended or preferable for hijama. So let's understand, what is cupping therapy? I know it goes back to the days of our beloved Nabi Kareem Sallallahu Alaihi Wasallam, and we as Muslims we do get involved in this practice. You are a physiotherapist. So when, how do the two come together, cupping therapy and physiotherapy?
Okay, so just to briefly go through it, so hijama is actually the Arabic term that refers to wet cupping. So wet cupping would involve your cups that you would place on various parts of the body, typically the back, and then you'll generate a suction pressure on it using a handheld pump, and thereafter you'll create your lacerations or your incisions on the skin, allowing blood to exit the body. So in my practice as a physiotherapist, it depends on the need of the patient and the type of patient that I'm seeing. Some patients, for example, if they're young, fit and healthy and don't have any muscular problems or any medical complaints, then I would use the cupping therapy as a stand-alone treatment for them. However, if you get patients coming in with specific medical conditions, such as your sprained knee or ankle or muscle that has been pulled, then as a physiotherapist in my practice, I would use cupping therapy in conjunction with other treatment techniques to help improve the patient and heal their condition.
Okay, so how do you position hijama or cupping therapy as a medical treatment? Would it be complementary therapy or a faith-based practice? Or is it encompassed kind of taking all three elements in and then applying it to your patients?
So yes, it is a combination of all three elements. Cupping therapy is actually, like, there's been so much of benefits that we've seen in our patients that we've done the cupping therapy on. And we would use it in conjunction with the other treatment techniques. So as I said, it just depends on the need of the patient, the type of patient that we're seeing, and what the patient also would want us to do with them as well. Yeah.
Okay, so you're a physiotherapist. I presume you spent about 3 or 4 years studying physiotherapy. Let's look at cupping or hijama. Once you qualified as a physiotherapist, how long did you spend in, learning this technique? Where does one go to learn it? Is it certified? Do you recommend it to other physiotherapists or other healthcare professionals? How does it all come together in your practice particularly?
Yes, so just to track a little bit back with the cupping therapy, so a lot of members of the public have a misunderstanding with regards to the dry cupping as well as the wet cupping, which we refer to as the hijama treatment. So the dry cupping is your non-invasive cupping. So that would just involve cups being placed on various parts of the body, and you'll generate the suction pressure using the handheld pump. And thereafter, after a few minutes, you'll then release the cup of the skin. And that is said to improve blood flow as well as reduce muscle tension and stiffness in that specific part of the body. So that would be the dry cupping. So in terms of physiotherapists, any healthcare professional can do the dry cupping because it doesn't entail much. And then the wet cupping, that's where you would need further training on it. So that's the cupping that would involve the lacerations as well as the exiting of the blood to the body with that type of treatment. So there is the South African Hijama Society that provides the training for practitioners, and they also then would certify those practitioners to perform the wet cupping treatment.
Okay, we're going to go for an ad break in a minute or two. So let's just understand the training of wet cupping. How long does it take? You've also indicated that it's certified, but you are a healthcare professional. What about people who are not in the healthcare professional, any layperson, could they then apply for the wet cupping therapy? Because I'm kind of thinking that if, there's an issue around bloodletting, how safe is it for a non-medical person to be involved in this type of therapy?
So yes, the training is open to members of the public who do not have a medical background. So it involves a 6 to 8 week training process with the South African Hijama Society. So that would involve a vigorous training process where they would go through course content covering your anatomy, physiology, as well as the theory behind the wet cupping process. Part of the training would be how a practitioner would handle the lacerations made as well as the contamination then, so to basically store the blood products and to get rid of your blades and your medical waste and all those processes around it, particularly focusing on the infection control part. Because it's an invasive treatment, there is a lot of focus and emphasis on the infection control and to prevent any risks as well. And then at the end of the course, there is a theory examination, which candidates have to get 80% and above, as well as a practical component where a practitioner has to perform the wet cupping technique on 5 patients, and examiners then examine them on the processes, and thereafter, if candidates pass the theory and the practical component, then they do get certified by the South African Hijama Society.
Okay, let's go for an ad break. When we come back, lots more to cover on the show this morning with you, Muaaz Saith, as a physiotherapist and hijama therapist as well, of course.
Rejuvenating media day by day. This is Salam Media.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Al Bayt Lodge, your true home away from home. Al Bayt is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities, conveniently situated close to Port Elizabeth Airport, the beach, and other amenities. Your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Al Bayt has to offer. For reservations, call 041 583 6415 or visit www.albaytlodge.co.za.
Yasin Badat Financial Advisory, Are your financial goals feeling out of reach? Yasin Badat Financial Advisory is here to turn your aspirations into achievements. Our dedicated team, armed with a history of success, is ready to guide you through the complex nature of financial and investment planning. Whether you're a seasoned investor or new to the game, our personalized solutions cater to your unique goals and risk appetite. Trust in our commitment to transparency, integrity, and excellence. Ready to unlock a world of financial freedom? Partner with us today. Call Yasin Badat Financial Advisory at +27333462071 or visit www.yasinbadat.com. Yasin Badat Financial Advisory, guiding you to financial success.
Hey, Gulam.
Yeah?
Did I return your lawnmower last month?
No, bye, you didn't.
Oh, no. Now what'll I do? I wanted to borrow it again, man.
With Randry Jewelers, you won't have to borrow or lend because the prices are so well trimmed on all gold and diamond jewelry. Alternatively, we could remake your old jewelry into a brilliant new design. Visit Randry Jewelers at 151 Stevens Lamini Road, Musgrave, Durban. Randry Jewelers, the family name you can trust.
For too many communities across Africa and the world, access to clean water remains a dream. At African Muslims Agency, we dig deep, reaching into the heart of the earth to fill the cups of those in need. Sponsor a water well for only 16,500 Rand or a borehole for 65,000 Rand in Africa or Afghanistan. With water comes food, health, education, and growth. Give water, give life with Africa Muslims Agency.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and welcome back to the Mid-Morning Talk Show with me, Julie Ali. We are talking with Muaaz Saith. He's a physiotherapist and he is in private practice at the Crown Med Day Hospital in Johannesburg. We're talking hijama cupping, but we'll also touch a little bit on physiotherapy and, of course, to better understand how the two different therapies complements each other and can work to give you great results. Back to you, Muaaz, and let's talk about the wet cupping, which obviously, involves a bit of bloodletting. I should imagine minimal bloodletting. However, it is invasive, but also I should imagine minimally invasive. But are there risks involved, medically speaking? Because you spoke about responsible disposal of blades and perhaps a bit of the blood and swabs, etc.
Yes, so there definitely is risks that's associated with the wet cupping. So because it's an invasive technique, one of your biggest risks is infection. So that's especially if the practitioner is not using sterile blades or if the technique is also not sterile, then there is the risk of infection. And as you would imagine, because of the lacerations made, there is the risk of increased bleeding, especially if the lacerations or the incisions are made quite deep. There definitely is a risk of increased bleeding. And because there is an amount of blood that's getting expelled from the body through those lacerations made, it can at times lower a patient's blood pressure and cause some dizziness. And in extreme cases, then it may also cause fainting as well. So these are the risks that are mainly associated with the treatment. However, with practitioners, we obviously would screen our patients beforehand and we would take them through the process. And we obviously use blades of that are sterile and we dispose of it per patient, so we don't reuse any of the blades. It's a one-time use only as well. And obviously, with the lacerations that are made, it's done in a very controlled manner, not to make it deep. So there's no deep cuts that are associated with the wet cupping. It's actually superficial cuts. So by its nature, it shouldn't cause excessive bleeding as well. So yeah, these are the risks that are associated with it. But as practitioners that have went through the training, we try as much as possible to mitigate the risks.
My word. I've just realized, even though you're talking about, superficial, incisions or cuts or lacerations on the patient's body, there is still a risk. And I've now realized that if ever I do need to have this form of therapy, I certainly won't go to a lay person. I certainly will consult someone like yourself with, a medical background, because you're right, it is risky. Not that we're knocking those lay people, but oh goodness me, it does come with risks, does it not?
Yes, definitely. So as much as possible, we advise members of the public as well. So like if you go to any practitioner with cupping, as much as possible, make sure that they have some form of training. They might not necessarily have to be a medical professional, but at least having went through the course with one of the Hijama societies. To actually protect the patient as well as practitioner accountability, and to also increase public trust in this form of treatment. Also, just to note that the Hijama treatment has a very big misconception of it being very painful for patients. So we often get patients coming in and telling us that, look, they've had the Hijama treatment done like a few years ago, and it was some traumatic experience, and it was painful for weeks and months thereafter. And they actually still show us like the scars that are left on them from that particular session. So just to actually clarify that the Hijama session, by its nature, is not supposed to be painful. It's not supposed to be a painful or traumatic experience for a patient. If anything, it actually is supposed to be a very therapeutic, calming, and relieving treatment. There shouldn't be any long-lasting scars or marks that are left on the patient after the treatment, because as I said, the incisions or the lacerations have to be superficial and not deep as well. So those are the misconceptions that we often encounter. And sadly enough, it actually turns a lot of patients away from the treatment. So because of that specific traumatic event, they actually never have cupping done again. So so we advise members of the public as well that cupping is actually therapeutic. It's a treatment that would be very relieving post-session as well.
So clearly those patients that suffered trauma when they went for the initial sessions, Hijama cupping, were probably not in the hands of very capable or well-trained practitioners. So how does one actually verify that you are with a legitimate Hijama practitioner and just don't and that you are in safe hands?
So you have to ask the practitioner if they have any form of certification with any of the Hijama Society bodies. That would be the best way. The cupping space or the Hijama space in South Africa is a largely unregulated space. So there's no specific bodies like HPCSA that's providing oversight to practitioners. So as much as possible, the responsibility is then on the patient to actually check that the respective practitioner is certified in the treatment that they are offering.
So what about the organization that actually does the training. So if I decide I want to become a hijama practitioner, I would have to go for the training that you spoke about earlier on in the interview. Should they not take the responsibility then to try and get affiliated with the HP Health Professions Council? Or is it too, I guess, cumbersome to become registered?
So at the moment, plans are in motion for the South African Hijama Society to actually get accredited with the HPCSA. But as you would imagine, it's quite a lengthy and vigorous process where the HPCSA would need a certain number of practitioners part of that society before they can consider getting them under the HPCSA banner. So as much as possible, we're trying to get as many practitioners part of our society, and plans are in motion. But the South African Hijama Society is currently a member of the International Practitioners of Holistic Medicine. So we are part of an international body as well, and that helps to regulate the space somewhat.
Okay, so you've had over 6 years of experience regarding physiotherapy. How much experience do you have in hijama cupping?
So I did my course in Hijama last year, so it's just about a year now that I've been practicing using the Hijama treatment on my patients.
Why did you decide to go this route? Clearly, being in the physiotherapy space for over 6 years, you're obviously, doing pretty well there, practicing out of the Crown Med Day Hospital, which is a lovely facility as well, very centrally placed. Why the deviation, or I suppose in conjunction with your physiotherapy practice, you decided to go this route? That's part one of my question. In terms of part two, what measurements or measurable results have you seen in the patients you've treated? And how do you verify that, it is in fact working?
Yes. So, okay. So to answer the first part of the question, so for me personally as a physio, cupping therapy or the hijama is an extra tool in my toolbox. So as you would imagine, we would do treatments such as dry needling or acupuncture. We do massage therapy. We'll do the electrotherapy as well on our patients. And obviously a big part of managing our patients would be to exercise therapy as well. So that would involve rehabilitating and stretching and strengthening those specific muscle groups that are in question. And cupping therapy is in my practice in conjunction and complementary to the other treatment techniques, specifically more with your muscular tension and muscle spasm, muscle tightness conditions as well. Also, interestingly enough, there's been a lot of awareness around cupping recently. A lot of my sports patients would come in and they'll tell me that, okay, they saw this high performance athlete or swimmer with these red circles on their neck and their back. And is it cupping? Tell us more of cupping. And do you do cupping and things like that? So I actually took quite a keen interest from many of my patients as well that have requested about this cupping treatment. And I then wanted to empower myself and I went for the course and to now offer it to them here at Crown Med Day Hospital as well.
Are you pleased that you've actually undergone the course? And how, when you have a patient come in, who makes the decision that, the cupping therapy would work in a particular instance? Or would you combine physiotherapy like they do with the dry needling? The physio will say, okay, they do a bit of massage and then say, I'm going to do a bit of dry needling as well because it will help the muscle pain, it'll relieve it quicker, or whatever the situation is. How does that conversation, kind of get going?
Yes. So it's on a patient-to-patient basis. It depends on the need of the patient and what the patient presents with. The final decision of what treatments will be used rests with me as the practitioner. So depending on the needs of the patient. So as I said, cupping therapy in itself can also be done on a perfectly normal patient. So if you're a patient with no medical conditions, you have no medical complaints, there is no muscle aches, there's no pains, there's nothing whatsoever, you're perfectly fine, you can still get cupping done for its wellness benefits, which is improved blood circulation, and those things. So, however, if it is where the patient has a particular problem, for example, they were running and they pulled their thigh muscle, then we'll do specific treatments, and cupping may or may not be part of that. And that's how we would manage those patients. And personally, in my practice, I often do cupping, especially with patients where I see they presenting with muscular tension or muscle tightness problem. And I've seen some fantastic results with it, especially in terms of reducing the pain as well as improving the range of motion in that particular limb or joint, as well as the overall functional movements, such as squatting and lunges. So as a physiotherapist, we use a lot of objective outcome measures to actually see from session to session, is this particular treatment working on our patients? And then in terms of pain, we'll use like a pain scale where patients come in and they'll actually grade the pain, for example, on a scale of 1 to 10, of how severe the pain is. In terms of their range of motion in the joint, for example, if it's the knee that you're treating, we'll try and assess the degree of mobility in the knee. And we'll compare that from session to session, as well as the functional overall movements, like in the squat, in the lunge. We'll actually break down the sequence of that particular movement, and we'll see whether there's any improvement in their mobility. And that's how we'll actually assess our treatment and the success of our treatment from a session to session basis.
Okay, the all-important question then, Muaaz, can hijama replace conventional treatment for any condition as far as muscles are concerned? Or is it only a supportive treatment? So as a physiotherapist, you'll do what is necessary for the patient to relieve the tension or the tightness of the muscles. And then just as a supportive treatment, then introduce the hijama.
So I think it's a combination of both. We've seen some patients that have responded well to the hijama treatment only. This is for muscular conditions. And we've also seen patients that have responded quite well to the other treatments, and the hijama is complementary to their treatment as well. So it's a bit of both. It depends on the patient, the problems that they're experiencing. It depends on the practitioner as well, and what he or she thinks may benefit the patient at most. So I think, to answer your question, it depends on the patient. It has to be taken on a patient-to-patient basis. For some patients, the hijama may be sufficient for them to heal fully. For other patients, they might need other forms of treatment that we do, and the hijama is a supplementary to that as well.
Okay, someone's asking that they do understand that hijama and physiotherapy is really all about muscle health. That when people come to you, they've probably got a sprained or a strained muscle, and then you obviously work on it and give them relief and give them exercises as well. Does this work for pinched nerves as well?
Yes, so cupping therapy can be done for pinched nerves as well. It's well supported in the guidelines as well. And as a physiotherapist, we would then do other treatment techniques on those patients as well. So yes, to answer your question, cupping therapy can be done on nerves. It can be done over joints. It can be done over ligaments, tendons, and then muscles as well. Yeah.
Who should avoid hijama completely? What sort of medical condition that certain people present with that should not even consider hijama at all?
So this is a really good question, and this is where the certification comes in. So practitioners that have underwent the course and the process would be able to actually screen patients and pick up those patients who should not proceed with cupping. So whereas your other practitioners might not be able to identify those patients. So because the treatment is an invasive treatment, and there is a degree of blood coming out of the body, your patients that have any blood disorders, so that may be anemia, that may be patients with leukemia, and patients that are on strong blood thinning medications such as warfarin, those patients are actually contraindicated to receive cupping therapy. The main reason is that obviously they may lose excessive amounts of blood as well. Ladies who are pregnant as well, cupping is not advised for them, so that's also another contra indication. But the main one would then be patients that present with bleeding disorders as well.
We've almost come to the end of the interview. I have one or two important questions that we do have to cover. What should a first-time patient realistically expect, and what is often, with due respect to you, but what is often overstated in that first consult?
Okay, so as a first-time patient, your practitioner has to screen you for the reasons that I've just mentioned. If you may present with any bleeding disorder or blood disorder or any form of cancer, or if you may be pregnant. So that would be the first step in the process. You need to undergo a basic screening by your practitioner. Thereafter, with the wet cupping, there would be certain areas on the body, typically the neck and the back, where the practitioner would place cups, and then they'll generate a suction pressure using a handheld pump on those cups. And the cups would then suction the skin for, you're looking at about between 5 to 7 minutes. Thereafter, your skin actually sort of gets desensitized to a certain degree, and then the practitioner would make the controlled lacerations on that area of the skin. So it shouldn't be a painful process at that point. At most, a patient should feel like someone is scratching on the back with a pen. And thereafter, the cups are placed again on that particular spot with the suction pressure. And that is then where blood gets expelled from the body. And that process is for about 5 to 7 minutes. And thereafter, the practitioner would then remove the cups and wipe the blood off that particular area. And that actually would be your cupping session in a nutshell.
Do you band-aid it afterwards, the incisions?
No, so actually the sunnah is after the hijama session to actually apply a layer of black seed oil or olive oil over the area, and that has actually been said to prevent any infection on the skin as well. And yeah, it shouldn't be a hypersensitive area. After about 2 to 4 hours, patients can shower and they can continue with their normal daily life.
Okay, we've almost come to the end of the interview. I could sit here talking to you all day. But, you spoke about the cupping. The cupping, when you put the cups on, then it desensitizes the skin. But have you guys, as hijama therapists, given any thought to perhaps using a numbing gel or a numbing solution that will decrease any pain for the patient, especially those patients that are very queasy about pain, they're very afraid, and you know, they become very anxious about the process itself?
So no, so with the numbing creams that are applied on patients, we actually don't recommend that and we don't advise that, because in the event the practitioner goes too deep with their lacerations, the patient might not be able to inform the practitioner of that as well. So we do counsel our patients that there might be some discomfort as the lacerations are made. But obviously, if it's quite deep, then the patient would tell us. But if the numbing cream is there and it really numbs and desensitizes the area completely, it could be quite a deep laceration and the patient might not feel it at all. And the practitioner might not be aware that it's actually very painful for the patient.
Oops. Okay. Let's wrap up then. And the all important question: does medical aid cover these hijama sessions? And question number one. Question number two: if people come to you, you are a registered physiotherapist, and they have physiotherapy in the first part of their session with you, and then the hijama cupping, would that then be covered if the first part of the question is no, medical aid does not cover hijama cupping, but if incorporated with a physiotherapy session, will it be covered?
So unfortunately, hijama treatment is not covered by medical aids in South Africa. If I were to see a patient and will perform the physio techniques on the patient, which would be covered by the medical aid, then we'll bill the patient according to that. But the part of the hijama that would not be covered by the medical aid would then be the liability of the patient to cover with the physiotherapist. So there's
Okay.
specific treatment codes that we would do on a patient. For example, if we did dry needling as a first treatment on the patient, and thereafter we did massage therapy on the patient, and the third and last treatment was the cupping therapy, the medical aid would only cover the first and second treatment, and the third treatment of the hijama would then be the liability of the patient to settle with the physiotherapist.
Approximately how much? Give me a thumbs up figure.
So it varies. At least between 400 to around 500 or 600 would be the price of a hijama session with a trained practitioner.
Jazakallah so much. It's been wonderful talking to you. You've truly given us a deep insight into what hijama is all about, and also the fact that it complements a physiotherapy session, I should imagine, to a great deal. So thank you, all the very best, and I hope you grow from strength to strength. Assalamu
Shukran for
alaikum.
having me.
Absolute pleasure. Assalamu alaikum.
Salam.